Hello and welcome back. Today I want to make a special video for my pregnant patients. There are different types of diabetes that could be during pregnancy, such as type 1, type 2, or gestational. Of course, when you're pregnant, you don't stop being diabetic if you had pre-existing diabetes, such as type 1 or type 2. And then gestational diabetes occurs during pregnancy because you become more insulin resistant because of the pregnancy. So with these different types of diabetes, we have the same concerns, and those concerns are for the safety and the health of the mother as well as the infant. Now, we have two people that we're worried about. The blood sugars being very elevated puts you at a very high risk of miscarriage and stillbirth because, again, we're talking about compromising the circulation to the infant. So we definitely want to prevent that. The other things that you're at higher risk for are a very large infant, and when the baby's very large, that puts you at a higher risk of C-section and a lot of other unnecessary complications, preterm delivery, things that we really want to avoid. And then, of course, one of the things that we worry about when the blood sugars are very elevated immediately prior to delivery or during labor is that for type 2 diabetics and gestational diabetics specifically, when your blood sugars are very elevated, now your pancreas is working overtime to try to keep up with the demand for insulin. And so it's pumping out all this insulin, which is going into the baby's bloodstream. So when the baby is born, and the baby's born with all this insulin circulating, and then all of a sudden the food source has been cut off because the baby is no longer in its mother's womb, then we see hypoglycemia, and so that can be very dangerous as well. So those are the major things that we want to avoid. With pregnancy, we want to keep those blood sugars as close to normal as possible. Our goal is that we want your fasting blood sugar first thing in the morning to be less than 90, and we want your 2 hours after eating blood sugar to be less than 120. Your 2 hours starts from the time you take that first bite of food, and then you're going to time it for 2 hours and check your blood sugar. If it's not less than 120, or if your fasting blood sugar is not less than 90, those are things that need to be addressed, and somebody needs to be adjusting your medications, whether you are on pills or insulin or diet controlled. Something needs to be adjusted to get those blood sugars to goal. And it is possible with type 2 diabetics that you may have been able to control your diabetes prior to pregnancy with just pills or with just diet. And then during your pregnancy, you have to be on insulin to keep them at goal because you become extremely insulin resistant. It's possible also for type 1 diabetics to become more insulin resistant and need to be on higher doses of insulin during the pregnancy, especially towards the end of the pregnancy. And then with gestational diabetes, it may go on through the pregnancy that you become more and more insulin resistant as well, and will have to require higher and higher doses of insulin. That's very common. The good thing with gestational diabetes is that it clears up immediately after delivery. It's like a light switch. 1 minute you have it, after delivery you don't. Your blood sugars go back to normal. So typically, we want to see those gestational diabetics back in the clinic in about 6 to 8 weeks because we want to do another oral glucose tolerance test. The reason for that is because a lot of times type 2 diabetics are not diagnosed prior to pregnancy, and it just so happens that they get diagnosed during pregnancy. And so we want to make sure that it actually is gestational diabetes and that you don't have an underlying type 2 diabetes that needs to be treated, because if that's the case, we want to make sure that we catch it early and that it's treated. So definitely make sure that you keep your follow-up appointments for that. If you're able to keep your blood sugars at goal with just diet, that's great. It's going to be the same as the normal diabetic diet that's recommended, as far as what we recommend for our patients, except for gestational diabetics, instead of limiting the carb intake to 60 grams per meal, we want to limit it to 45 grams per meal, which is about 3 servings. So we're a little more strict. We definitely want to keep a close eye on those blood sugars, keep a close eye on the baby, and make sure that you have a healthy pregnancy and delivery and that you are able to deliver a healthy child. And so that's our number one priority. If you have any questions about this content, feel free to comment in the comment section and I will answer it to the best of my ability. If you feel like you know somebody who would benefit from this, whether it's a family member or a friend, a healthcare provider, nursing student, any diabetic person that might benefit, please feel free to share my videos. Don't forget to subscribe to my YouTube channel and like my Facebook page, A1C to Z, the ABCs of diabetes. Thank you and have a good night.